Hello and welcome back to the Reform for Resilience European launch. My name is Diane Stone. I am one of the newly appointed professors in the School of Transnational Governance at the European University Institute. And it's my pleasure today to be the moderator of the session on a healthier work environment. And some of the issues that we're going to cover today, and there are many issues in this particular topic, is what the workplace might look like in the future as we come out from the vicissitudes of the pandemic. So how can we make our workplaces healthier? How can we make our workforces more resilient as our business models and our working patterns are being transformed by the impact of the pandemic? And there are many positives in the stories as well as many significant challenges. I have to say, for me today, it is certainly a healthier work environment because I'm not sitting and working at my kitchen table. It is simply quite liberating to be able to see some of my colleagues face to face rather than on camera through Zoom. So what I would like to do before we tackle some of the big issues about a transformed workplace after we come through the pandemic, I'd like to introduce some of our speakers that we have on the panel today. We have three excellent speakers. So let me first mention Marcella Panucci, who's one of the Reform for Resilience commissioners. But also since February this year, Marcella has been head of cabinet at the Italian Ministry of Public Administration. But for many viewers, she's probably better known for her many years of service with Confindustria, I hope I've pronounced that correctly, which is the General Confederation of Italian Industry and the National Chamber of Commerce, where she was Director General until the middle of last year. But she has also worked earlier in her career at the DG for Competition in the European Commission, and she's also affiliated. She's got a teaching gig with Luis University in Rome, where she teaches public economic law. So she is one of our first panelists. We are also joined by Professor Franklyn Lisk, who is a development economist and policy advisor, currently based at the University of Warwick in the UK, where he specializes in international political economy of African development, as well as global health governance, and has recently been appointed the Academic Director Africa in the university's executive office. Outside of Warwick, he holds many other positions, and he is a senior associate at the Center for Research on Political Economy in Dakar, Senegal, which he co-founded in 2009. For a number of years, he worked with the Geneva-based International Labour Organization, holding a number of positions, including being founding director of the ILO Global Program on HIV, AIDS, and the World of Work in 2000. So welcome. And also, last but certainly not least, we have Timo Lappi. And Timo is a growth entrepreneur based in Helsinki in Finland. His background is as a lawyer, and a lawyer who went on to be a co-founder of his own legal services Fondia, which was one of the first publicly listed law office in the Nordic countries. More recently, in the past 8 years, Timo has spent his time challenging occupational healthcare services market and was one of the co-founders of the company Heltti, which is known as a disruptor amongst healthcare companies. And today, Heltti has a team of 70 healthcare professionals who are responsible for the well-being and health of around 13,000 people. And Heltti's approach is that it believes in preventative services instead of just medical care, and as well as making the best possible use of digital solutions in health services. So welcome to all. We have much to cover. And what I'd like to do is perhaps to start on a positive note. Before we get to some of the challenges for creating healthier working environments and opening economies in as safe as possible fashion. But I thought it would be good to first dwell upon some of the benefits that have actually emerged from the impact of the COVID-19 pandemic, the kinds of new innovative practices that might have emerged, or the way in which we now think about work and reflect upon economic development. So, for example, last week, The Economist released its special report on the future of work, where it identified some positive signs amongst the gloom. So I wonder, and we might start first with Marcella. Marcella, do you think perhaps the pandemic has hastened some of the changes that perhaps were already underway, trends towards remote working, trends towards increased automation, as well as new digital and cross-border business models? Do you have some thoughts in this regard?
Thank you, Diane. It's a very challenging question to which I will try to answer, taking into account also my past experience as Director General of the biggest industrial association in Italy. And I find also some parallelism with the job that I'm doing now, because the public administration is the biggest employer in Italy. We count on 3.2 million civil servants. So I have both views of what's going on into the private sector and what's going on into the public sector. And it can be compared, and it's quite similar, because when the pandemic exploded, and unfortunately Italy was the first country in the Western world to experience it, we immediately skipped to the digital environment for many services, and for work as well, and for schooling, for whatever else. The only services which were provided physically were the services to the persons, and specifically health services. And I noticed with some optimism, to be honest, that the country was ready to skip to the digital. Because in 1 week time, we were all working from home, and all the students were schooling from home, and that was really amazing, a sort of miracle. I have to be honest, I never expected that the country could be so ready to do that. And I always thought that if we had to plan it in advance, probably it would have taken us ages to do that. While in emergency, good or bad, but anyway, we did it. And the telecom system was okay. We experienced no blackouts, no problems on the network, and also digital services were able to support the country in the outbreak of the pandemic. So everything is okay? No, it's not. Because of course, we had two questions. The first one was that not all the areas in the country, and I can imagine in Europe and throughout the world, had the same level of digitalization and access to digital services as some, metropolitan areas or most developed areas in the country and in the regions. And that was a problem. And not all offices or schools had the same access to digital services. The same public administration was experiencing some problems with millions of acts and administrative practices which were stopped by the pandemic. So we have a workload which has increased over time. So the pandemic showed us that there's still a lot to do to re-engineer and digitalize services, and also re-engineer the way we organize the labor market and the labor and the employment within public and private organizations. Starting from that, I think that we call it smart working. I know that's not the right English terminology, but nonetheless in Italy it's very well spread, and we call smart working from home, which is not really smart for many people. But nonetheless, it's quite diffused, and it's posing some problems as well as opportunities, especially for families, for example. And we adopted some measures in the last few months in order to support families who were at home with small kids, doing digital schooling, and not being able, above all women, to look after the kids if they had to work from home. So there are many social problems which are connected to working from home that we have to try and face and solve, as well as not everybody's got a home who allows for home working with spaces, with technologies, with facilities. So there are many problems which are connected to this new way of working, and that we have to try and face, as well as we have to reflect on the fact that there are some kinds of employments and works that cannot be made from home. Services to person, for example, food, tourism, or whatsoever, they cannot be provided from home. So there were, and there's a very interesting article on The Economist, on the report The Economist made on how the labor market is changing, that talks about that. So there are luckier and less lucky workers that can allow working from home or not working from home. And especially most fragile workers, they cannot work from home, and they have to be very well protected. And that's, let's say, an issue that you are posing to in this seminar today, which is very interesting to face. How do we protect our workers, essential workers, key workers who cannot work from home during a pandemic and afterwards? Of course, vaccines are the first mean to protect people, and also the first weapon we can use in order to relaunch economic growth. But nonetheless, vaccines are not yet generally available, and we also are experiencing some problems with the quantity of vaccines that can be used for the population.
Yes. Yeah.
I don't know whether I'm going too long. Just feel free to stop me.
No. It's fine. It's fine. And yes, it's not that we're necessarily going to stay in this mode of smart working or remote working and being based in the home. Economies around the world will gradually open up, and governments obviously play a big role in informing communities about what is and what is not safe working conditions, but business has a role as well to play here. So it'd be interesting also to hear how business can be proactive in managing and helping develop a smooth as possible transition to the reopening, we hope in summer, of our workplaces to workers again and to clients.
Diane, I think it's what you say is absolutely correct, and we start having some data from the lockdown experience, during which many businesses, however, remained open. Those essential businesses like manufacturing companies, some manufacturing companies, or some services remained open. And the data we have is that they experienced a very low level of contagion within manufacturing companies or other kind of companies who were able to adopt very strict rules about worker safety. I remember at that time I was in Confindustria, and we signed 2 protocols with the trade unions in order to envisage the best measures to adopt in factories and in whatever business environment in order to allow workers to work safely. And luckily, that those measures were successful. So I have to say that in that case, we can try and manage new openings being, let's say, somehow sure that those measures will be adopted. But anyway, that's another question. We cannot stay closed forever, and we have to start and reopen, especially services like, for example, restaurants, shops, and so on. That's a huge part of the economy that has been hugely struck. And we have to try and think on how to do that. Of course, lots depends on vaccines.
Yeah.
We cannot escape the question.
Yeah. This is going to be an inventive process, and it's not something that's just going to happen this year. The whole idea of building resilience is something that is a mindset. It's in a regulatory approach. It's about business responses over the next 2, 3, 5 years. This is something to be built into our economies, our workplaces, and firms. Does business have the resources to do this, given that economies have been so hard hit over the past year? What kind of resources do you think they need to start pushing ahead on these fronts, and workers and workers' bodies?
But on a more general plan, I think that loads of resources have been put into the economy in the last year. So I was reading a few days ago an article on the Financial Times on a new Washington consensus, which is spend, and not cut anymore, which brought the United States to a huge package for the economy, as well as the European Union and also Italy. We invested more than 100 billion euros on social support, on liquidity, on supporting the economy in a wide sense. And that, of course, has somehow frozen the economy. We have a ban on layoffs as well, and lots of money which has been put on social bumpers. So what's going to happen when this all will be over? I hope that the investments we will put in place through the Next Generation EU facility that the European Union has approved will rebalance the possible shock on the economy deriving from the withdrawal of all support measures. So at the moment, companies can afford this, can afford taking measures and invest on worker safety. Yeah. We have to care about what's going to happen in the future.
Thank you. And Frank, I'm wondering, given that you were working on HIV/AIDS, and part of your past research has focused on Ebola, two other very different kinds of pandemics. What is there that we can possibly learn today in Europe, but also in other countries, from past pandemics and the responses that have taken place in the past in relation to managing pandemics and then redeveloping economies and ensuring safety for workforces?
Thank you very much, Diane. As you mentioned, I spent many years at the ILO, and there are three things about the ILO that I believe are quite relevant to the current pandemic, as well as to past pandemics and lessons from past pandemics for resilience and recovery with respect to COVID-19. First and foremost, the ILO has always emphasized the importance of partnerships, in this case, tripartite: government, business, and workers. And I believe that if you want to look at the impact of the pandemic globally or in the world of work, you need to look at the principal actors, how they interact with each other. So I think this is the first point. The second point would be to look at the impact of the pandemic on the labor market and unemployment situation. I was fortunate in the year 2000 to have been invited by the Director General of the ILO to set up a new program within the organization, the Global Program on HIV/AIDS and the World of Work. And one of the first things I realized when I was given this responsibility was that not only is the HIV pandemic a global problem, but fundamentally it was a development challenge in the sense that because of the way the pandemic was perceived and because of the way the major actors reacted to the pandemic, it became first and foremost um, a, a factor in terms of human resource capacity. People were excluded on the basis of the assumption that they cannot participate in the labor market and they were discriminated against, they were stigmatized. So that's one important outcome, and it affected their access to productive and remunerative employment. And it also was a threat to their fundamental rights in terms of security, human security. I should also point out that ILO, like many UN organizations, thrive on slogans, but ILO, unlike many UN organizations, try to concretize the slogans into action and practice. When I joined the ILO, the slogan at the time was basic needs. Work should contribute to meeting basic needs of individuals and their families. And about the time I left the ILO, the slogan was on the quality of work, decent work. Everyone in the ILO was talking about decent work. What does it mean? Work should be productive, it should be adequately remunerative, it should be safe, it should be socially satisfying. Now, if you look at the the pandemic, well, let me go back to HIV and AIDS. Most of the requirements for decent work were breached by the way employers, in some cases, even governments, responded to the pandemic, and the ILO had to insist on some code of practice. And one of the first outputs of my new assignment at the time was to develop an ILO code of practice on HIV/AIDS and the world of work, which provided guidelines for action. Now, in the case of COVID, I mean, we don't have that problem in terms of stigma and discrimination, but what we have is the economic impact, which has been quite significant, the economic impact due to lockdowns, and it has contributed massively, particularly in the developing world, to loss of employment, exclusion. I read an Oxfam report which indicated that an estimated 50 million additional people in Africa will be pushed into extreme poverty on account of the labor market and unemployment impact of COVID. Now, the other point is that unlike HIV and AIDS, where the response at the global level was quite different from what we have experienced for COVID, at the global level, there was first and foremost international cooperation, which led to the establishment of a new UN organization, UNAIDS. And the second was this organization was given the responsibility to coordinate the global response. And it was supported by financial resources to ensure that the coordination of the global response was supported with material inputs. And this led to the establishment of the Global Fund, which was the largest financing agency to support a disease that was not necessarily rampant in the global north, even though the AIDS was essentially in the global south. It is quite interesting that there was this synergy and understanding between the global north and the global south of the importance to provide support. Now, unfortunately, in the case of COVID, what we have seen is one, a disconnect, total, as far as I can see, very little international cooperation, let alone coordination. The WHO, until recently, has not been allowed and has not been able to fulfill its role as in terms of international coordination, nor has there been cooperation between the major players or the major regions. For example, a lot has been said about vaccine apartheid, vaccine diplomacy, vaccine inequity. But what we see is that what is playing out in the area of vaccine is clearly, again, quite different from what came out from the experience of Ebola. When Ebola broke, particularly the West African Ebola, 2015 and 2016, it was amazing that the key, if I would use the phrase, metropolitan countries, i.e. Britain, France, and the US, decided to address the problems in Sierra Leone, Guinea, and Liberia with some sort of coordination. So what I'm trying to say is that there are certain lessons that come out clearly from the experience of earlier pandemics, which we should not overlook if we're talking about resilience and recovery. And let me just round up or mention again the ILO. You see, the ILO has been working in areas which are today relevant, but they've been doing it for quite a while, like homework. Now everybody's talking about working from home. ILO has published quite a lot. But even from my time years ago, homework was a very important aspect of ILO's agenda, because ILO was looking at home working from the point of view of the disadvantages of working from home, except that now we're looking at home working or working from home from a more positive perspective. There are certain advantages, but ILO associated homework primarily with casual work, uncontracted work, piecework which exploited workers. Then the other area, which of course has been highlighted by COVID, is digitalization. Here again, ILO has been looking at digitalization from the point of view of the application of automation in the workplace. Will people lose their jobs to machines? And this is again playing out. So it will be interesting to see when we look at the situation in the context of a post-COVID recovery, when so many things are going to happen, including reconfiguration of global supply chains, including the manner in which the people interpret work. We're going to see a need to come out with a new conceptualization of work. We're never going to go back to the old normal. And it is in this regard that I believe that there are lessons to be learned, both in terms of the impact of the pandemic on employment and the labor market, and with respect to the response as far as recovery and resilience are concerned.
Thank you, Frank. It was an interesting point that you made about the extent of global cooperation when it came to Ebola and HIV/AIDS, which stands in stark contrast to the vaccine nationalism of today. Yeah. And Italy, as it currently holds the G20 presidency, this is something to definitely have on the agenda when it's hosting the Global Health Summit later this year, to talk about the forms of global cooperation and the lessons that can be learned from HIV/AIDS and Ebola in the past that you're talking about. But you also mentioned the slogans of the ILO, and one of them today is human-centered recovery. And on this particular notice, I'd like to turn to Timo, given that he's a disruptor in healthcare. And I'm just wondering what you think the general requirements might be for something that's human-centered recovery in these new work environments, in the transformation of work, whether it's from home, some time or part of the time or full time, but also what that means for companies that need to also encourage that amongst their workforce and manage this new mode of business and to ensure productivity in these processes.
Thanks, Diane. It's a great opportunity to get to attend this panel about healthier workplaces, since that's been the main object of my work since for the latest 8 years at the moment. I'd say that it's been a really interesting 15 months for a growth entrepreneur and also for a business leader working in the healthcare business. I think that I've been having 3 different perspectives for this time. First of all, the perspective of a growth entrepreneur trying to make new innovations and challenge the old ways of working and providing medical services. And then secondly, the viewpoint of a business leader who is ultimately responsible then for the well-being and health of 13,000 people here in Finland who are using our services. And then naturally also as a third issue, then as the CEO being then responsible for the well-being and health of 70 healthcare professionals who are working at our organization. I think that it's if we think about the positive sides of this extraordinary time, it's been then like fast forward in the development of healthcare services that were still very conservative before the COVID-19 area, I think. Mm-hmm. I think that there are 2 really interesting issues that are really my passion. First of all, it's so that you should be focusing more on preventive services instead of just providing medical care for sick people. There are numerous studies that show that it's much more cost effective, and it's also more effective in terms of time used by medical professionals if you are then targeting healthy people and really supporting them to stay healthy instead of just forgetting them and focusing on the sick people. And then as a second issue, also I think that let's have an example from another branch, for example, from banking. Still, maybe 20 years ago, people used to do so that when they got invoices, they really went physically to a bank and then paid the invoices there. How it's done then nowadays is that you get then the electronic invoices to your mobile phone, and then you just go there with your Face ID, and that's done. Nobody would then like to go back to the traditional way of paying bills, at least in the Finnish environment. How about then, if you think about what you do then when you have then something to communicate with a doctor? 20 years ago, the traditional way of doing that was then to book an appointment and really physically go and visit the doctor. And I would say that the quite a lot the same system still continued last year until then COVID-19 started. And what was really interesting was that when naturally the lockdown started, there was a tremendous pressure then to try to create new ways of then communicating with doctors. And I would say that if you think about then doctor's appointments, all such appointments where you just are discussing, or then the doctor would be looking, or it would be listening, but not touching you. All of those could then be also done remotely. And what is the really positive side here is then that with digital solutions and with remote services, we will be then able to use the doctor's time in a more efficient manner. And we know that there's a constant scarcity of doctors' time all over the world all the time. And I think that it's positive news. Franklyn just mentioned that there will be then technologies and digital solutions that will be then replacing people's work, and it might be threatening people. I think that the healthcare professionals, they have no threat at all, because then there will be constant need of their time, and then these new kind of services will then be enabling them to use their time in a more effective manner, really facing people and really actually meeting them. And then, sorry, Franklyn.
No, it's okay. I just wanted to react to the issue of digitalization and all these advances that would, in my view, to some extent, minimize the human-centered focus of the ILO. Obviously, it is important to increase efficiency. It is necessary for the recovery. The recovery has to be cost effective, but at the same time, the recovery also has to be people centered in terms of how it affects the way people live and work. And already we have seen massive dynamics in the way in which we interpret work and in the way we use work as a source of livelihood and well-being. I think it was Marcella who mentioned changes relating to the environment, and I think this will be particularly relevant. There are going to be trade-offs with respect to certain gains in productivity, which might impact on environmental considerations, or certain gains in productivity, which might in fact impact on well-being and leisure. It would be very difficult to envisage people who have spent the last 12 months working from home going back to the rather rigid regime, starting with if you were working in a city, you have to commute, the rush hour traffic. And I don't really see how people are going to get back into this old way of working without massively disrupting certain benefits that they have experienced. Okay. So it would be a matter of how do we rationalize the sort of changes that Timo is talking about with what I consider to be the non-quantifiable benefits from work, which we refer to in the ILO as the socially satisfying dimension of work.
Yeah. And on that note, Timo, it's a very big question, the intangible aspects of life. You mentioned that doctors have scarce time, and unfortunately, I'm getting messages that our time is becoming even more scarce. So perhaps if you could respond to that question and maybe bring in some of the points that you've seen in Finland about how we have that human-centered approach.
Yes. I have a few interesting data points I would like to share with you, and I will just be making that very briefly. We have the statistics about the well-being and also then sicknesses and sickness leaves of around 13,000 people. And what happened then during 2020, the first part of that, during the first wave of COVID-19, was that the sickness leave rates, they dropped materially. That was positive news since the infections, they stopped spreading. And in addition, there were a lot less injuries because people, they just stayed home. But then what I think that is very relevant from the viewpoint of being then human-centric and supporting really people is that during the second wave of COVID-19, we identified a completely new phenomena that was the mental challenge-based sickness leaves. They started skyrocketing, and also the demand for psychologist support by our members, it increased nearly 50%. So this says to us that people, they really will be needing support for the mental challenges. And still, what we have learned from previous crises at different workplaces is that part of people, they react during the crisis, but then there are also major parts who start to react only after the crisis has already been finished. And this is why I believe that also after we hopefully have returned to the offices next autumn, we see that there will be a huge need to support people mentally. when they return back to their offices.
Thank you. Yes, it's been traumatic in many different ways for people, and I'm very sorry to say that we've run out of time in this particular session, and we've barely scratched the surface. But I do hope at some point in the future we can carry on this kind of conversation and talk about the reforms and transformations that are needed in the workforce in both the tangible and intangible sense, from the business perspective, the workers' perspective, and also quite clearly a governmental perspective as well. So thank you very much for your time in joining the European launch of the Reform for Resilience Commission, and look forward to seeing you in the future.